This course has been by far and away the best CME that I've ever taken. It's been 2 days of so much information that's going to help me on a day-to-day basis with my patients. I think I need another week just to sit down and figure out how I'm going to incorporate it into my practice. But this was an amazing 2 days.
Now I understand the excitement that other physicians have had about the course. My colleague in San Antonio was very excited and came back really wanted to make a lot of changes to his practice, and I feel that way now as well.
I know that there is the whole field of preventive cardiology that is rapidly developing, but I think they're the only ones that really have put together a course and a preceptorship to impart that knowledge to other people.
I would have to say that the Bale Doneen method is the best conference that I have really ever attended. I can honestly say that because they have taught us information that we can really use to prevent the most common risk of mortality.
Dr. Bale and Amy Doneen have been very good at trying to emphasize that you have to invest your patients in their care, that you have to look at the root causes and identify the disease and why it is progressing and how it progresses, and intervene to stop events from happening.
They really approach it as a team effort with the patient and looking at risks and changing behavior, and then really aggressively encompassing the patient in toto as one individual and not just little pieces here and there that they're trying to snippets that they're trying to fix barely.
My understanding of what I learned during the Bale Doneen preceptorship, I think, is radically going to change my medical practice, and I will certainly send out notification to all my current patients that we need to reassess their status.
I think that the most important thing for me is what I'll be able to do and take home to my patients, and the things that I'll be able to offer them now that I wasn't before. And we'll be able to really help to predict for them what the likelihood of an event will be based on the numbers and things that we check. And I think that'll help to motivate patients more by having that information and being able to see things that we're finding and being able to correlate that to bad things happening, and hopefully that'll motivate them to make changes in their lives.
Every primary care physician should really be involved in this and understand it, because I don't think it's something we really understand. I've been in practice 30 years, so certainly lipids has really changed a lot. It was the most boring subject when I was in medical school, and even as a resident, I could barely remember any of that. We've learned so much, and it's really a much more exciting field, and there's so much to understand. I think that this method is something that should be embraced by the medical community, but I'm scared that it just takes so long for standard of care to change.
We're in such a crunch in healthcare right now financially. When we start really delving in this, it's few dollars up front, but long term, it's many dollars saved. And I think encompassing it into this aggressive level is just a necessity. It's actually a shame that we're not doing it already.